how come if, I trip over this table and I hurt my leg and I break my bone, I can get treatment regardless of my ability to pay, right? Or most places in the U.S. Why doesn't that same principle really apply to dental care? Like, I could have a rotting tooth that hurts so badly, and dental care, for some reason, it has like a separate insurance, and the work is not really performed unless you could pay for it.
Yeah, I don't know why it's like that. It's really bad. And there is a rule that, like, I'm assuming you have insurance, because if you, let's say, get into a car accident and you don't have insurance, the hospital still has to stabilize you. That's a rule. I think it's called EMTLA or something. It's like a federal rule that the hospital has to make sure you stay alive. Because imagine they're waiting to see if you have insurance before saving your life, and all of a sudden you lose. Right. So they're not allowed to make a decision on whether or not to save your life based on insurance status. But going to see a primary doctor, they might not see you if you don't have insurance and you're not able to pay. So it's different based on emergent and non-emergent. And dental care is a lot like mental health care. Why is it so difficult to get in to see a psychologist or a psychiatrist in comparison to seeing a cardiologist? When really, if we invest more in our mental health care system, we get better outcomes in our cardiac care. Because as we were just talking about, your mindset impacts your physical symptoms. Like, not just your knee pain, but it also impacts your blood pressure. If you have a very high blood pressure, your heart has to pump against that. As a result, if it's doing that long enough, it develops heart failure. And that could come as a result of a mental health situation. So investing in our mental health would yield tremendous returns. But I'll tell you why insurers don't do that. Because they constantly swap who they're covering. So as a result, usually one insurer will cover a person for a shorter period of time, not their entire life. You'll have multiple insurance plans throughout your life. But if we decrease that number and one insurer covered someone throughout their whole life, then they might see the benefit of investing in preventive health, mental health, dental health. Because then you'll have less problems. But because they'll see you only for these 3 years, they're trying to maximize their earnings and decrease their spending. So it's messed up.
I never thought of that before.
Yeah.
What?
That's mind blowing.
I'm like, you're blowing my mind. I'm just asking you. Yeah. I'm just asking you all the medical questions.
Please, these are all good medical questions.
What about chiropractors? Because there's people who are like, oh, I got to go to the chiropractor, and then there's the opposite who are like, that's a scam. Now, how does traditional medicine view chiropractors?
Traditional medicine has probably a negative skewed view of it. Because there's less rigorous randomized controlled studies, which is like kind of the gold standard that we use to make our decisions based on like what we believe is to be proven. I think that there are good chiropractors and there are problematic ones who make false promises and start practicing outside of their scope. But I also have patients who get tremendous relief from it. It kind of falls into that gray zone. It depends of what's happening, because a lot of what is taught in chiropractic medicine may not vibe with traditional medicine. But in the end, if you're treating the body, like the muscles, the fascia, like true physical conditions, and you're not making false promises on those, you can help patients a lot. But I do see a lot of BS in that space. But to be fair, I see a lot of BS in the regular doctor space as well, with doctors promising miracle cures with their supplements and stuff. So it's like, it really depends is the bottom line when it comes to it. But I will say that all the cracking videos on social media probably go too far with what they're promising. And when I say too far, I mean probably a lot of the benefit that people are getting from those are more placebo benefit, meaning that there's a person who's an authoritative person telling them that this will help their situation. And if you have that and nothing else happens, 30% of the time, it'll get better. It's like that joke from Anchorman, like 30% of the time, it'll work 100% of the time.
I feel like that's still good though, right? Because it still does alleviate to some capacity if it is placebo.
Net positive?
It could be good, as long as it's not discouraging you from seeking something that's truly going to help your situation, one. Or B, if it's not causing you harm. And there have been instances of some chiropractors doing things, and again, doctors as well, that can cause harm. So some of the manipulation's gone wrong, things like that, so.
Yeah.
It's tough. Like you want to be really responsible when you say, oh, placebo is good because it's actually causing net positive. Well, is it coming at the cost of something? And is there also something negative happening as a result?
But isn't it true that you can get your like back kind of kinked out and like, is there a thing of just like aligning your backbones, your spine?
So alignment is probably overstated and overpromised. I'm also happen to be a DO, like a doctor of osteopathic medicine. So I also do some of the hands-on manipulations. And what I want to make very clear about it is it's not a magical cure for anything. The idea of osteopathic medicine comes from the idea that the body heals itself. And we are really just like accessories to help it heal and optimize it healing. And we make use of the body's own natural mechanisms. Like for example, if you activate your bicep and you let it win, the body's actually sending two signals, one to the bicep to flex and simultaneously one to the tricep to relax. Because you will not be able to flex if your tricep gets activated in the same moment. So you get an activating signal and an inhibitory signal.
Everyone who's watching is doing this right now.
Exactly.
Yeah.
So you get activating signal here and an inhibitory signal to your tricep. So if you think about that, let's say you have a spasm in your tricep. You can activate the bicep, have the person do some exercises that can help reduce the spasm in the tricep because we're using the body's own reflexes. And there's all sorts of things that we can do, from myofascial techniques, rib raising techniques. Like for example, in patients that have asthma, if they're going into a full-blown asthma attack, their work of breathing is going up because they have to work really hard to breathe against a closed airway. That's what happens. It becomes inflamed and closed and tight. That's why you get wheezing, the whistling sound. So you have to work really hard to breathe. And the danger in asthmatic patients, why they get intubated, is because they start tiring out from breathing so hard. And as a result, if they tire out too quickly before the asthma attack resolves, they actually have a buildup and trapping of carbon dioxide, and it can be deadly. So we intubate those patients, and we allow the asthma attack to recover while we help control the removal of carbon dioxide for them through the breathing machine. But now, as an osteopathic physician, there are things that I can work on the ribs, the muscles surrounding the ribs, the diaphragm, to help reduce some of the work of that breathing. Because if they have a spasm in their rib muscles or in their diaphragm, I can help treat it with some very basic techniques to reduce that labored work of breathing, to potentially buy them time where maybe they don't need to get intubated. And that's kind of how osteopathic medicine works.
Probably get asked this all the time, but what about cracking your back?
You cracking it yourself?
Yeah.
Probably not the end of the world. Like there's research that people used to say, like a popular myth, that cracking your knuckles leads to arthritis. That's been disproven. We don't see that happening. The only small thing that we've seen is if you consistently crack your knuckles, you may have lower grip strength. So it's a very minor thing.
Small payoff for the
satisfaction.
satisfaction.
A nice crack.
And again, that's like cracking it all the time and not doing exercises. Like,
Right. I do feel like loosened up. Like after I crack my fingers, you know, they feel
Is
more
that
like
is that a
mobile.
placebo, or is there actually any sort of research about like I crack my back, it feels better, I feel more limber?
It's, first of all, every time you're cracking your back, you're taking it through the full range of motion. So you're essentially already opening it up by doing that. And when I say opening it up, what I'm saying is by creating movement and activating those muscles, you're bringing circulation. When you bring circulation, muscles heal better, they move better, you're taking them through the full range of motion. In fact, that's why they crack, because you're putting them to their end range of motion. So you're kind of stretching that joint space, you're popping that air bubble, you're creating that noise. So yeah, stretching is good. And when you stretch, sometimes you hear a popping sound. So that's what people hear, but it's really the stretching and the movement that's making you feel good, not the actual pop. Because sometimes we do adjustments in osteopathic medicine where oftentimes you'll hear a pop, but what we're trying to achieve is not the pop. The pop just happens, but we're trying to take people through their full range of motion.